We've discussed the importance of structure and support in dealing with ADD. Medication can also be an extremely useful component of your treatment.
The various medications that we now use in the treatment of attention deficit disorder can dramatically improve the quality of an individual's life. The following information on medication is intended to supplement, not replace, conversations with a physician or other counselor. You should never take any medication until you feel you have learned all you need to know about it, and you feel comfortable with this course of treatment.
There are two main classes of medication used in the treatment of ADD, the stimulants and the antidepressants. The same medications are used in both children and adults. For both children and adults with correctly diagnosed ADD, some medication will be effective about 80% of the time. First, let's consider the stimulants. The most common is Ritalin, generic name methylphenidate. Other stimulants are dexedrine or dextroamphetamine and Cylert or Pemoline. As their name implies, the stimulants act on neurotransmitters to activate or stimulate the central nervous system. In ADD, this has the effect of helping the individual to focus or attend more fully than before. They also can have a mood-leveling effect. Despite common misconceptions, there are some things that the stimulants do not do. They do not drug up or cloud the sensorium of the individual taking them. They are not addictive in the doses prescribed for ADD. They do not take away the creativity or special something so many people with ADD possess. However, there may be side effects. Using Ritalin as an example, the most common side effects are the suppression of appetite and loss of sleep. Blood pressure and heart rate may also be elevated. These side effects are dose-related and may be avoided by lowering the dose. The second category of medications prescribed for ADD is the antidepressants. Of these, norepinephrine, generic name desipramine, is the most commonly used because most of the research on the antidepressants in ADD has been done with this medication. It is in the class of drugs called the tricyclic antidepressants. Although it is a completely different substance chemically from the stimulants, norepinephrine has a similar effect upon the target symptoms of ADD. Sometimes when a stimulant does not work, norepinephrine will, and vice versa. There are several advantages of norepinephrine over Ritalin and the other stimulants. First, norepinephrine can be given in a single daily dosage. This eliminates the need to remember to take a pill several times a day. Trying to remember to take medication for ADD brings up a kind of catch-22. How are you supposed to remember to take the medication that is supposed to help you to remember to take your medication? Second, norepinephrine does not produce the jagged peaks and valleys some people experience on Ritalin. It is smoother, evener in its action. Third, norepinephrine is not a controlled substance, and so there can be greater flexibility in prescribing. Controlled substances can't be refilled automatically, and prescriptions are limited in the amount that can be prescribed at one time. Common side effects of norepinephrine include dry mouth, mild urinary retention, and transient lowering of blood pressure upon standing up, which results in dizziness. People occasionally develop cardiac arrhythmias while taking norepinephrine. There have been instances in which these arrhythmias have resulted in sudden death. This is extremely rare and can be watched for by EKGs and by monitoring blood levels. But one should monitor norepinephrine carefully, especially at higher doses. In addition to the stimulants and antidepressants, there are various medications that can be used adjunctively, either to treat side effects or to improve the effect of the primary medication. Medication is not the whole treatment for ADD. It is a useful and powerful adjunct, but it should never be regarded as the complete treatment. Spend time preparing yourself to take the medication, talking about it, getting questions answered before you start, and your chances of success will be greatly improved.